This second wave of COVID-19 is having a different kind of impact when it comes to race and ethnicity. Erie County health officials say a greater number of white people are now dying, while the death rate among people of color is at its lowest level in quite some time. 7 Eyewitness News reporter Madison Carter takes an in-depth look at the numbers behind this latest trend.
When we first started with COVID in March, we had no tests. Okay, this community had no tests. We had to fight to get tests to the community. Now we have the test.
The community with the least amount of resources and highest number of negative health factors took the brunt of COVID's force at the onset of the virus.
We know that 3 of the conditions that make people most vulnerable, diabetes, heart disease, and asthma, are 3 things that are real prevalent in the Black community. And we have to put forth some kind of a program, some kind of a plan to address these issues.
It was a $3.8 million plan that shifted the outcome for Buffalo's most vulnerable this fall and winter, and it started in the church.
Your call is really larger than just your parish.
The African American Health Disparities Task Force had been in operation for 6 years before the pandemic hit, formed by a group of local clergy and health leaders. It shifted back in March to become the Health Equity Task Force and developed a plan of action in conjunction with health professionals.
We got lists from the Board of Elections and other sources and by zip code. And we just called people to check on them and say, hey, how you doing? What's going on? Do you need access to testing? Do you need food? Do you need primary care?
They're called COVID response teams, and they worked out of 25 inner city churches, an outreach effort to take information and resources to those without a way of getting it before.
Part of our issue as African Americans and those of us of color, we might have access. Sure. You think you have access because you go to an emergency room, but that doesn't mean we're connected to the system.
Health and clergy leaders credit Erie County funding these COVID response teams with the strong management of the virus in the Black and brown communities during the second wave.
Now, as we get into the second wave in Erie County specifically, we're seeing white, affluent, suburban areas have the highest number of cases. If you look at the data itself, let's start there. What does that tell you?
It's behavior. It's behavior. I mean, what this pandemic has exposed is the tremendous selfishness in the American way of life.
COVID does not discriminate. COVID will get you no matter who you are.
Dr. Peter Winkelstein is the executive director of healthcare informatics at UB. He says this spike started because of what we could not control. People moved inside.
Transmission of the virus seems to have increased very suddenly towards the end of October. And not just a one-time thing, not just Halloween parties or something like that.
And throughout November, numbers have only increased, Winkelstein says, because of many factors: COVID fatigue, mask opposition, even economics.
Is there a reluctance to get tested by people whose jobs may be affected or their ability to do their jobs may be affected by a positive test?
All right, and Madison joins us now live. Madison, you mentioned economics there at the end. How much are experts looking at economic factors when it comes to how this virus is spreading, I guess, in this second wave?
It's something that I haven't really heard us talk about too much. The experts I was talking with today, they said we're in a health crisis focused on economics, small business. Even today, a $908 billion bipartisan plan came down from Congress with no direct payments to Americans, right? It's all about the business. And they're saying Americans are worried about paying their bills. So sick people are going to work because there's no money going directly to Americans. So they're saying that's really going to contribute to the spread of this virus. It's human nature. It's what we've done forever. Go to work if you're not feeling a little bit great, but this time it's the coronavirus, but the habits haven't changed. So they said that's something we're really going to have to watch from the federal level coming down to help fight this virus this time around.
All right, very interesting. Our Madison Carter reporting tonight. Thank you, Madison.